What are the causes of breast cancer, and how can it be prevented? There is no single cause of breast cancer, but there are several factors that increase the risk of developing it. Although scientists have not yet been able to identify clear and confirmed causes of infection, they have identified several risk factors that doctors rely on to educate women about steps to reduce the incidence of breast cancer and the importance of prevention and early detection. In this article, we will discuss the most important causes of breast cancer in women, the prevention methods that must be followed to protect against infection, and the types of foods that help prevent breast cancer. Causes of breast cancer. Age. Recent research has shown that advancing age increases the risk of breast cancer, affecting approximately 8 to 10 women over the age of 50. Therefore, doctors advise the need for periodic examinations for women from 50 to 70 every 3 years to check on their health. Family history. The risk of developing breast cancer increases if a woman has a family history of breast or ovarian cancer. However, because specific causes of infection are not known yet, it is not necessary that the increase in cases of infection in the same family be due to genetics. But if there is more than one case in your family, periodic follow-up with a doctor is necessary to check your health. Previously having lumps or cancer in the breast. Having benign lumps in the breast does not lead to breast cancer, but in some cases, benign lumps can hide malignant lumps. Therefore, if any lumps appear in the breast, it is essential to consult a doctor and find out whether they are benign or malignant. In previous cases of breast cancer, the matter can develop and return again or affect the other breast. In this case, rapid intervention is necessary, and following up with the doctor should not be neglected. Increased high-density breast tissue. The difference in breast tissue density due to the accumulation of mammary glands responsible for milk production leads to an increased risk of breast cancer. Hormonal therapy. In some cases, the female hormone estrogen causes activation of cancer cells in the breast. This occurs because the ovaries store the hormone estrogen to regulate the menstrual cycle, and in some cases, when girls reach puberty at an early age, it results in exposure to a large amount of female hormone, which helps in increasing the chances of getting breast cancer. The chances of infection and spread of cancer cells increase with the increase in the amount of estrogen that the woman was exposed to during her life journey. Taking birth control pills. Taking birth control pills increases the risk of breast cancer, but the risk decreases when you stop taking them. Therefore, continuous follow-up is necessary throughout the period of taking the pill, and you may also need to follow up with a doctor after 10 years of taking it to check on your health completely because some women were infected again after this period. What are the characteristics of a breast cancer mass? The shape of a breast cancer mass is one of the things that a patient cannot determine on her own, but they may feel the presence of a tumor or mass, which often has a solid texture. This mass can be located under the armpit, in the breast, or close to it, and it is one of the most common signs of breast cancer mass characteristics. Additionally, the injury may appear in the form of swelling in the breast or near the armpits or collarbone, and this can be caused by more than one type of breast cancer. Breast cancer can also appear as a change in the skin of the breast, making it feel thicker, similar to an orange peel in shape. These symptoms are similar to those of a breast infection, and most of the time, it is cancer. Among the changes caused by breast cancer is redness and dryness in the nipple or the breast itself. The shape of breast cancer differs from the shape of a benign tumor, which is determined by the doctor through a mammogram. Benign tumors are usually round and have clear borders, unlike malignant tumors that do not have clear borders. Where is the breast cancer lump located? A breast cancer lump can appear near the breast, such as the collarbone or an armpit, and usually forms on one side of the breast. It is important for every woman to know the nature of her breast so that she can notice any changes in it. Therefore, every woman must do a self-examination every month after the end of her period to be reassured. The method of breast self-examination is as follows. 1. Stand in front of a large mirror in a sideways position. 2. Put your arms at your sides. 3. Look closely to notice any changes in shape or color, or the presence of any ulcers or peeling in the breast itself or the nipple. 4. The examination room must have strong lighting. Prevention of breast cancer. 1. Maintaining a healthy weight and avoiding obesity. 2. Regular physical activity. 3. Breastfeeding, especially for longer durations. 4. Avoiding alcohol consumption or limiting it. 5. Avoiding exposure to radiation and environmental pollution. 6. Periodic examination, especially for women over the age of 50. 7. Foods that help prevent breast cancer. 8. Cruciferous vegetables such as broccoli, cauliflower, and cabbage. 9. Fruits, especially those rich in antioxidants, such as berries. 10. Foods rich in fiber, such as whole grains and legumes. 11. Foods rich in vitamin D, such as fatty fish and egg yolks. 12. Foods rich in omega-3 fatty acids, such as nuts and seeds.